Hello, good afternoon. This is Yamilet Zegarra. I'm the resource coordinator and also bilingual navigator. That is actually have to do with health insurance and also applications for GetCoveredNJ and NJ FamilyCare, which is well known more as a Medicaid. The reason we're doing this update is because we want to make sure that all our communities are able to understand about Medicaid services that April 1st was terminated, and that extension for health insurance, especially for Medicaid, was during the pandemic for everyone without really paying attention that much to the income level, and is now terminated since April 1st. So we want to make sure that everybody in the community, especially in New Jersey, are able to understand what is the quality of health care, how to get health benefits, how to plan with experts, in this case, with any certified navigator or assister for health care, compare cost and benefits and see what you can qualify for. Like I mentioned before, the enrollment begins April 1st, which is called more like a special open enrollment. So we need to make sure that everybody are registered and getting health insurance. Otherwise, it will be penalized at the end of the year when you need to go and do your taxes for 2023. Now, everybody, people who already have GetCoveredNJ, which is marketplace, you could be so many different, health insurance out there. If you have to make any changes, life event, let's say you have a new child at home that was born this last month, and you need to make sure that you can let the health insurance know about this, and because most likely your income will be lower due to the fact that you have a new member at home, right? And also you have to make sure that if you are still eligible, we have to make sure for any updates in your family. And also if there are no changes, then it will just automatically be renewed for the following year. Is that okay? So we want to make sure that if you have any life event, lost your job, or you get a new job, make sure to let us know so we can verify that information and you are able to continue with your coverage, which is very important. Otherwise, it's quite expensive if you don't have health insurance. Who is eligible to apply? Again, we know everybody in New Jersey who is primary resident, anybody that might have a green card or U.S. citizens, or at least to have a lawful right to be here, let's say, using perhaps the employment ID permit or things like that. So including with the Social Security, and they're going to be able to apply. So whoever is here as a refugee, as I understand lately, they might be able to get insurance as well, as long as they have the what is called the employment permit and the Social Security. Just let me know. We can always register and get your information into the application for GetCoveredNJ and be able to also help you to get better coverage for health insurance. As mentioned, always health insurance will always come with monthly premiums, which means monthly premiums is just the payments that everybody has to make a payment. It could be from $1 depending on the income. It could be $600 depending again from the income. So this is something that we don't really know for sure unless we put all your information, including expenses, if you have child support, if you are paying for student loans, all that is be counted in the application to be able to for the system itself to let you know what will be the options available for you and the payments. I always suggest to make sure that you need to understand what type of health do you have. If you are the type of person that will visit, the doctor 2-3 times a year, versus those that are having chronic conditions and might need to go 6 or 10 times a year, right? So it is important to learn what conditions that you have in order to choose a health insurance, because it will be better if you learn about that. In that case, you will be able to choose a better plan that will cover not only your doctor but also medication. If you need any emergency and you are in that emergency several times during the year, could be very, very expensive. So it is important for you to understand what type of health do you have, so that be able to use it and manage it in a proper way. So as we understand, New Jersey also offers financial help. Usually an insurance might cost you around $600-700. That's usually the cost of an insurance monthly. But if your income is lower than the poverty level that we have, maybe the New Jersey state will help you out to pay. How is that going to work? For example, if an insurance is costing you around $600 or $700, well, NJ state will pay, let's say, $600, and then you have to pay $100, the difference, right? If your income is really low, most likely they're going to send you for Medicaid, or they will say, hey, I'm going to pay $700, but then you're going to pay just the minimum $20 monthly, right? So that's how it works. It's not that the insurance will the health insurance will reduce the price for you to pay now. It's actually that state the same. It's a New Jersey state that will help you to pay that amount of money every month. Okay, that's different than having to go to the primary care doctor and paying your copayment, which could be $10, that could be $25. That's a little different. So the information here, and the main information that we want to make sure, is that NJ FamilyCare is trying to determine who is going to be eligible on April 1st, 2023. I mean, this month. What does this mean is that everybody who has Medicaid previously, and they were actually having extended Medicaid due to the pandemic, this service is over. It has finished, meaning that Medicaid will start reevaluating every single person that has Medicaid based on the income. And this is a surprise for everyone, that they will receive a letter from Medicaid saying that the services has been terminated. This is starting from April 1st. So I want to make sure that everybody understands this. If you have Medicaid because of the pandemic, this will be terminated. You will receive a letter saying that it's terminated and that you need to reapply. When you reapply, this is when you can call us, Family Resource Network. You can call us to every navigator here. We are available to help you with that. Once you reapply, we're going to register in GetCoveredNJ. We want to not only register, we want to create a profile. We're going to do the application. We're going to submit all the expenses, and we're going to submit all your documents, like Social Security numbers and things like that, right? We're going to ask you to do a consent form, which is a form for you to let us know that we are allowed to use your personal information into this application once we get to that point. And we're going to submit all the paperwork. There is no need to go to NJ, to the NJ platform for Medicaid itself. There's only one platform, which is GetCoveredNJ. We're going to do only one application, and if you qualify, the system will automatically tell you at that moment that yes, you qualify for Medicaid. So at that point, your information and your application will be transferred to NJ FamilyCare. So that at that point, then we just send you, in this case, you will need to wait for a navigator from that specific department that will call you or send you an email to basically look into your case. That will be type of like a case manager, like say, that will actually reach to you and asking you for more information if they need it, or if not, they will probably renew it, and then they probably gonna send you your Medicaid card for you to start with your services. But that's how it will work. Okay, we want to make sure that everybody are able to understand that if you receive a letter of termination, you are able to apply again, but this time everything will be based on the income, not on the pandemic, because pandemic time it was just for everyone who were able to apply in the continuous, and it doesn't really, they didn't pay attention that much to the income of the household, but at this time they will. So if you think that you've received a letter, please don't hesitate, contact me. Let me know. I'm gonna leave my information here, and we also bilingual, so we can speak Spanish as well. So we have Russian, English, I believe Italian as well. So yeah, just try to make sure that if anything is happening in your current life or anything, just let us know, because it's important for you to get in contact with GetCoveredNJ, with your marketplace or with your insurance, to make sure that everything's in the right track. Otherwise, at the end of the year, when you need to do your taxes, there will be penalties. And besides that, I want to make sure that you understand that expenses from anything related to health is very expensive, very. If you end up in emergency, we are talking about $5,000 and up, just depending on the situation. So we don't want to, that you end up in that. So we want to make sure that you can have a coverage. Most of the coverage for health insurance, Medicaid or any other, they can provide preventive services for you and your family at no cost. They won't charge you anything. The only thing that most likely you will have to pay is the monthly payment or premium and your co-payment, and perhaps some medication. But make sure to, that you have all this. If you have kids, even better. You need to make sure that everybody in the family are having health insurance coverage. It is important. I cannot stress enough. It is important. Try to avoid duplicate coverage, meaning that if you think that you apply already in NJ FamilyCare, don't apply again in GetCovered New Jersey. I always ask them, if you apply for GetCovered of New Jersey, then it's simple. We're just going to use one platform to submit your application. We don't need to go into a different platform. That application will go straight to Medicaid or to Marketplace. There is no need to apply, because if you apply in one website, and then if you apply into another one, they will create that double application, and your current health insurance, if you have one, will be terminated. So we want to make sure that you understand that. Please, if you think it is a little confusing, again, I'm going to leave my information. Please contact me. We can help you. By the way, this is for free. Family Resource Network is a nonprofit organization. We work with the state. We do free services to you. Usually it takes about 30 minutes to do it. And it's better if we are able to do the application, because there might be some questions that might not be easy to understand. But we, as a certified navigator, we are able to work with that. Okay, so that's basically it. That's what we have right now. And I just want to say thank you for giving me the chance to be here and to help you understand better about that, and to the library. And again, this is my information that I'm going to leave, which is Yamilet Segarra for Family Resources. Thank you then.